What's up, guys? My name is Omarr, and today's topic is bulimia, or bulimia nervosa. So what is bulimia? Bulimia is an eating disorder that is characterized by binge eating behaviors and compensatory behaviors. Now, binge eating behaviors include eating large amounts of food in very short periods of time. And according to the DSM-5, it's typically within a 2-hour window. And also during these binge eating behaviors, the person would feel like they don't have much control over how much they're eating. And when a person binges, a lot of times they binge to extreme fullness, almost to the point where they're actually feeling pain from how full they are. Now, compensatory behaviors are exactly what they sound like. These are behaviors that are done to compensate for the binge eating behaviors and kind of offset whatever weight gain or feelings of shame and guilt that may be associated with the previous binge. Now, compensatory behaviors, these include purging or vomiting, excessive use of laxatives or diuretics, excessive exercise, and even fasting. And it's also important to note that these binge behaviors and these compensatory behaviors, they're often done in secret because there's usually a lot of shame and guilt that accompanies these behaviors. And in order to be classified as bulimia, these behaviors need to happen at least once a week for at least 3 months. And with bulimia, the thing about it is that these behaviors, they're heavily influenced by the way you think about your body shape or the way you think about your weight. Now, some of the symptoms of bulimia nervosa are swollen salivary glands, having a chronic sore throat, and also having a swollen throat or inflamed throat. It can also cause irregularity in a woman's menstrual cycle. Another symptom is that the enamel in your teeth will start to erode because of the stomach acid that's coming up every time you purge. So a lot of times you'll see people that have bulimia nervosa, people that have purged a lot, their teeth, you can tell that there's erosion from the decay of the enamel from the stomach acid. Bulimia can also cause gastrointestinal problems like acid reflux. It can also cause dehydration, which can lead to electrolyte imbalances. This is very dangerous because those can lead to strokes and heart attacks. And one thing to note about bulimia nervosa is that people with this disorder often maintain a normal body weight. So it's not necessarily something that's easy to notice if you're a layperson. So try to wipe your minds clear of any stereotypes that you might think about what bulimia nervosa may look like, especially in regards to race. It's not a white girl or a white woman issue, trust me. So what puts you at risk for developing bulimia nervosa? Well, the population at the highest risk for developing this are young adults and teens. Also, women are at higher risk than men. And bulimia nervosa, just like other eating disorders, is correlated with low self-esteem, a distorted sense of body image, and depression. And if you want to learn more about body image, there's a video that I did a while back that you can check out. Also, according to the NIH, researchers are finding that eating disorders run in families. And what they're finding out is that your risk for developing an eating disorder can be influenced by a combination of genetic, behavioral, social, psychological, and biological factors. Well, now that we know what puts you at risk for bulimia, how do you treat it? Now, bulimia is treated by using methodologies that promote adequate nutrition, reduce excessive exercise, and eliminate purging behaviors. Treatment may consist of medical care and monitoring. It may also include nutritional counseling. Family therapy can be helpful for parents in order to help them be able to get a better handle on what their children are eating and have more control and influence on how much they eat and when they eat. Also, cognitive behavioral therapy can help identify the patterns of thinking that lead to distorted body image, that lead to these behaviors of binging and purging and these compensatory behaviors that consist of, that make up bulimia nervosa. Also, some medications like antidepressants, antipsychotics, and mood stabilizers may be used to treat eating disorders as well as treat the depression and anxiety that may accompany these eating disorders. But if there's one thing that I want you to take away from this video is that bulimia nervosa is dangerous. It's not something to play with. If you're struggling with this disorder, I urge you to get help. If you know someone that may be struggling with this disorder, I urge you to try to help them help themselves and get help. It's not something to play with. It's very dangerous and it's very, very common. I think more common than we really know, because like I mentioned earlier, a lot of these behaviors are done in secret. So it's likely that there's somebody that you know that has either experienced this disorder before at some time in their life, or maybe going through it right now. So I just want to stress the importance of getting help, stress the importance of how knowing how dangerous this is, and I hope you guys gained something from this video. That's all I got. If you enjoyed the video, please like, share, subscribe. Like the page Mental Health for Us. I'm on YouTube and I'm on Facebook. Thanks for watching. Later, guys.